Joining me now is Dr. Jim Ireland, community physician, one of our go-to experts when it comes to COVID-19. Good to see you, Jim.
Good morning.
So let's talk about this Aloha Free Clinic that you announced recently. What was the reason you wanted to bring this up and offer this to the community?
Well, first of all, what we've gone through with the state and really across the country, but more so in Hawaii, is unprecedented economic changes because of COVID-19. And the stuff that's happened initially with the shutting down the air travel and the quarantine and stuff was all absolutely necessary to save lives. And it resulted in a lot of unemployment. When I saw the numbers reported 200,000, more than 200,000 unemployed. And I think Hawaii per capita has the highest unemployment percentage in the country of all the states. It's just shocking. And I know that most people that have medical insurance through their workplace, that's how they get their coverage. They don't have Medicare, they don't have Medicaid, they get it through their workplace. And, some of the employers were gracious enough to keep it an extra month, and so it would carry on for a little while. But it's our understanding that June 1st, a lot of people are going to fall off those roles, those plans, and it's pretty scary not to have medical insurance. If you've always had it your whole life, you're used to it, and people can continue it through something called COBRA, but you pay the premium yourself, and it's pretty pricey. I mean, I'm not sure how much, but maybe $500 to $1,000 or more, especially if you're trying to cover your whole family. And if I can imagine, if you just lost your employment, or you and your spouse just lost your employment, that could be impossible, really. So I think that's what kind of got us thinking about this. Now, a lot of people who lost their job were able to apply for Medicaid, and I heard that there's been something like 50,000 applications, that maybe less than that, but a lot of people are applying for Medicaid, and if they can get that, that is a great safety net, and people should apply for Medicaid or Medicare if they're eligible, if they've lost their what we call commercial insurance, like Kaiser, HMSA, HMAA, those plans. But in this gap, if their Medicaid application got denied for some reason, or if it's not been processed yet, we want to give people an opportunity or an outlet to get medical care or to get prescriptions refilled without devastating economic consequences. Now, emergency rooms are for emergencies, and by all means, if someone's having emergency, insurance or not, they need to go to the emergency room. But what would be unfortunate is if somebody just needed a diabetes medicine refill and they were unable to do that, and they were to go to the emergency room just for that, because that's a very expensive form of healthcare, because of all the stuff they need to keep the emergency room staffed and stocked for life-threatening emergencies. So for people who might need a diabetes medicine refilled, or an asthma medicine, or they have cholesterol issues or high blood pressure, and they just need that checked and meds refilled, that's what we feel our niche is. Now, we have also another safety net in the community health centers. Now, people who have gone to Kaiser or to Straub or to Queens or other private practitioners may not be familiar with these, or may not have utilized these in the past, but they're all over the state. I'm more familiar with the ones on Oahu, such as Kalihi Palama, KKV, in Kalihi, Waikiki Health Center, Waianae Comp. And these are federally funded clinics that can give people health care, sometimes at a reduced rate if they have income reductions. So these are go-to places. And one of the things we want to do is, if they do come to our clinic, we want to help connect them, if they didn't know how to do that already, to these community health centers, because we've committed to doing this for the summer. We're hoping that, and by summer, June 1st to August 31st, but we're hoping that people can get back on their feet. The economy is going to open up, and they can get back working again, and get their insurance.
Extensive measure for, like you said, a trend that you're seeing in the market. You really wanted to get ahead of that and serve this,
yes,
kind of fill that gap.
Fill the gap. But if people are going to need help longer than that, and we only do the clinic for 3 months, it's really imperative we get them tied into a community health center to take care. Because if diabetes goes untreated for months and months and months, you get really unfortunate and sometimes irreversible complications, things like kidney failure, stroke, other problems. Same with blood pressure. So we really don't want those folks to go without care in our state.
And how are you working with the state government or the health department on this project? Is there any kind of involvement?
This is completely private. It's being funded through private donations, and we've already received, a sizable number of donations. We've got about 40 medical volunteers so far that have offered to help. And so we're going to try to do this without tax money, without non-government, it's just volunteer. And if we get enough donations, we also want to try to cover people's lab tests and medicines, at least for the 3 months, if we're able. I'm not sure if we're going to have enough resources for that. The visit will for sure be free. But if we can do a little extra for people with their meds or their labs, because those all have a cost as well. And we've gotten some pharmacies and lab companies to come have approached us that they will be offering either free or very reduced rates. So we're hoping to be able to give people at least peace of mind for the 3 months that their chronic, whatever their medical conditions are, that we can help them with until, as a bridge, till they can get to the other side. And then if they need help kind of getting directed how to apply for Medicaid, we're hoping to kind of help people move in that direction. And again, getting tied in with the community health centers.
Yeah, so the question also is, are you going to be offering COVID-19 screening? Like, is this going to be an additional place for some of the uninsured to come and get their questions about this virus answered?
That's not our plan right now, to not do COVID screening. It's not that we can't maybe in the future. And we're gonna have to think about, if someone does come in with those symptoms, what to do. And I'd almost rather give them a voucher or something that we would pay for their COVID screening at an established COVID screening facility that's already doing it. But our plan right now is not to do COVID screening, but that could change. But we definitely would, if someone needs it, we'd help them find a place to get it. And I'd like to think we could pay for it for them as well, but I just not sure about that yet. The other thing we're not going to be able to manage, unfortunately, is chronic pain and narcotic prescriptions. We're going to have some nurse practitioner students with us and some others that don't always have a DEA license, which is required to prescribe narcotics. So we're not going to be a pain clinic, unfortunately. But there are some of those in the community that help with that, and we could maybe direct them to a place where they could get help with that. So those are kind of the two areas, unfortunately, we're not going to be able to help with. But for chronic medical conditions like asthma, urinary tract infection, diabetes, COPD, blood pressure, cholesterol, that's the kind of bread and butter stuff that I think we can really help people a lot with.
Mm-hmm. And I know we've been talking a lot with you about flattening the curve, and our efforts that we've seen have been successful in lowering the number of cases of COVID that we've seen here. Is this effort also part of a larger kind of initiative to minimize the impact on our healthcare community? How are we doing in terms of hospital capability and capacity? Are you trying, is that part of this equation, or is that just, again, you're filling the need for the insurance part for the people?
One of the big fears when COVID kind of started percolating in February were that people, one of the fears early on where people would be so afraid to go into a healthcare facility or a hospital that they would deny their own healthcare because they were just afraid to go into a doctor's office with a bunch of people coughing. And we understand that. And a lot of folks in the medical community have talked about, first of all, everybody who has been affected by COVID or has passed away, it's a tragedy. But we've lost 17 people in the state the last I looked. Very, very sad. But it would also be sad as if we lost 100 people to diabetes, heart attacks, or strokes because they didn't go get health care, or they were afraid to get health care. So, or they lost their insurance and couldn't get health care. So it's a balance that we definitely have to keep an eye on COVID. It's a killer. And the state's, I feel, done a really good job on the difficult measures that have had to be taken and sacrificed for everybody to dampen this down, where we're now just getting 1 or 2 cases, new cases a day, sometimes 0. So that's been a win, I think. And again, the 17 people passed, it's all very sad. And that's unfortunate. But when I look at New York and the deaths there, proportionally, it's just we've been fortunate as a state. But now that we're kind of through that, and we all know that we're not through it, but we've got a lot of the heavy lifting done. Want people to have complications from other healthcare problems.
Well, that's good news. Another option for a lot of these people. Now, looking ahead to um, how the response will be. Say you start getting these patients, and you might get a few that are showing symptoms. How are you going to protect the workers that are there? I understand these are all volunteers, right? Will there be enough PPE for them? What kind of precautions do you have in place to protect the actual workers there?
Well, in my own medical office, we started seeing patients a week or two ago in person, and patients are screened for a temperature. A mask is put on patients when they come in. Providers wear PPE. So you treat everybody like they could have COVID, although obviously we know they don't. So that just higher level of PPE. The other thing is within the clinic, in my own office, we've been doing social distancing where we haven't had people kind of in the same place. We limit the number of people in the waiting room. The other thing is we're going to do as much as we can by telemedicine. So just like you and I are talking through a phone or a computer, we'll offer that to patients as well. Now, you can't take the blood pressure over the phone, and sometimes it's hard to listen. Well, it's not hard. It's really difficult to listen to a heart or lung sounds over a phone unless you have some special equipment on both sides. But talking with patients, examining them, superficially, finding out symptoms, that stuff you can all do over the phone. So if we can do that, we will.
And I wanted to switch gears. We've talked generally with you from the very beginning about screening incoming visitors and what we can do to keep this virus out of Hawaii now that it's been contained pretty much in our own borders. What's your take on what's being worked on now? I know there's been discussion about thermal screening, about having people tested before they arrive. What do you think?
Well, as a community physician, I would love to see no COVID in the community. I mean, as a resident of Hawaii, I'd love to see no COVID in the community. And we look at places like New Zealand, and they say they've wiped it out. It's not in New Zealand anymore. They've, I think, closed their borders. But that is a very extreme solution that we know in Hawaii is really impossible because it'll devastate our economy. And we're one of many states, so people are free to travel. I mean, there's a quarantine if you come back, but people have rights to leave the state and come back and that sort of thing. And there's a lot of people right now that are thinking about this in government and in the private sector and the medical field. And I think there is a lot of talk about doing testing before people come here. Also testing once people are here, whether it be visitors or returning residents. I think one of the complications or complicating factors when I think about this is there's something like 50 COVID tests now. I mean, blood tests, antibody tests, finger poke tests, nasal tests, deep nasal tests, nasopharyngeal tests, testing for the virus, testing for the antibody. And they've come out so fast that a lot of people, especially health practitioners that aren't studying this super carefully, don't know which ones are the good tests, which ones are the reliable tests, which is the best test, which is the test that's no good. And the FDA, to their credit, has historically been very slow in approving things, and frustratingly slow. And they were the opposite in this case. They were just kind of approving things left and right. Maybe not their full approval, but the emergency use approval. But a lot of stuff got through that maybe wasn't so great. And so again, it's great that they let all these come, but now the FDA and others have to sort out what's reliable, because you don't want to use a test on anyone that you're going to make a decision on that's not reliable, because you're going to get not a bad answer, but you may get a wrong answer. And you let somebody in that you think is all clear, and they're not all clear. So if you're going to use a test for determining if someone has a disease, you really want to make sure it's the best one out there and reasonably cost as well. But most of these are, I've seen ranges from $9 to $127 per test. So, on the large scale, you want economy if you can. But main thing is, did you lose me?
Your visual is gone.
You know what? What's happening here? Somebody's trying to call me. I'm going to get rid of them. Back.
Don't they know that you're on? Oh, did we just lose him? Oh, it looks like he hung up on us. Well, he'll come back and call. Anyway, if you're just joining us, I was talking to Dr. Jim Ireland about what his take is on all the tests that are available out there to screen for COVID-19. because there are a lot of proposals out there in the government to have visitors who are arriving into Hawaii to have negative results, to show that they have negative results, basically have testing done before they arrive. Now, some experts have said that that's not feasible, that violates some rules, but let me let him back into our meeting. That's what we were discussing. There you are. Let him set up again. I was just updating our Facebook audience about what you were talking about while you were trying to fix that.
I'm back.
All right.
Technology. What were we talking about?
We were talking about your take on
Testing.
whether these tests, how reliable these tests
Yeah.
are, and there's so many of them.
Yeah.
So how
Yeah.
are we going to
And that's, everybody wants to test quickly and accurately and inexpensively. And I think a lot of people, are thinking like home tests would be great, and how the doctor's offices, I think, would like to have tests. And lots of people want tests, and I get that. And I think just, this is happening so fast. Every day new information comes out. But I know people really want to get the economy open and are thinking hard about how to do that. And I think having a reliable test, whichever one is out there is the most reliable, is part of the answer.
Yeah, and I
But
think,
again,
sorry,
I'm no expert in testing. I'm just going to declare that here. I've done some tests, tried some of the kits out, not in a clinical setting, more of just to kind of familiarize myself with them. They are easy, but I personally have used a few that worked great and a few that didn't work. So I had a friend who had COVID. He caught it in Colorado. He's cured now. He's a doctor, and he agreed to be a kind of a tester for these different kits. And we tested a few on him, and some showed the IgM and IgG appropriately, and one of the tests didn't. The test said he didn't have COVID, when we all knew he did. He was swab proven. So I personally have seen the different levels of reliability in the tests. And again, I'm no expert, but I'm waiting to hear from the experts to help us guide, our government officials on how to do this and which test is the best.
yeah, especially since discussions, like you mentioned, are now about reopening the economy. It's doing that delicate balance of, letting them in and making sure that who we're letting in are healthy, or at least we can handle the capacity our medical facilities here can handle when people do get sick. Are you
Yeah,
confident that we can at this point?
I am. I think that we're right on the edge of having some very good testing. We may have them already. I just, don't, like I said, don't know which ones are the best. But I think,
But as a community physician on the ground, talking to people, do you feel that there's a little bit more confidence in our, our response and how we're able to handle it?
I think so. And I think the state did a great job of what we've done so far in the social isolating and getting people to stay at home orders. And as painful as those were, they came just in the nick of time, because at the time when we were seeing 30 or 35 new cases a day, there was that maybe week when we were seeing that. I personally was at that point pretty worried, because I was just holding my breath that the next day wouldn't be 100 cases or 200 cases. And we stayed flat for 3 or 4 days, and then we started dropping, and we've continued to drop till now. So that was kind of a big sigh of relief from the people in the medical field, because our ICUs never got full, and the ventilator capacity never got really stretched, but it was moving in that direction. And nobody wants to see, unfortunately, what happened in New York City.
Yeah, and they continue to experience such loss. I just spoke to a friend who knew, a couple that died within days of each other, and
Yeah,
even
very sad.
impacted it just because of the, just how close everyone is in public transportation, and they just don't know. So it's just, yeah, like you said, very sad. But I wanted to give you a chance, Dr. Ireland. This is a good idea, this Aloha Free Clinic, to bridge this gap. Just final thoughts as we, go forward into this new week. Hopefully we'll keep the number of cases low. What's your advice for everyone out there as someone in the medical community?
Well, just keep following what's being broadcast on the news pretty much on a daily basis on what we're doing. And when you are out there, keep social distancing as we open up, and wear your mask. I still carry hand sanitizer with me. And, I went to Pro Ridge Mall yesterday with my family, and there weren't a lot of people there, but it was fun to kind of patronize some of the shops there and see people out. And so, we want to enjoy that too. I heard the beaches are busy, which is good, but as long as we're careful and mitigate any risks, I think that'll give us the best opportunity to kind of normalize things again without the risk of a lot of people getting sick. Regarding the clinic, I hope people find it helpful, and I hope we can connect people to community health centers or just bridge them until they can get their insurance again. But we'll be going up and going in about 2 weeks here.
And how can they reach you? Give us the information.
Right now, we just have an email. It's Aloha Free Clinic at gmail.com. And at some point, I think we'll have a phone number and a website, but that's it for now. We've already gotten some emails from patients, and we'll be answering those probably this coming week. The folks who've emailed us already and try to set up appointments for them, even by video. And we're there's more than 1 million people in the state, but it still feels like a small town in a way. And I think the providers that have volunteered and the others just want to help their neighbor, so to speak, and just we're all kind of in this together.
Yeah, very good. And thank you so much for coming on and telling us all about this exciting new program that you're launching. Dr. Jim Ireland, good to see you. Aloha.
Thanks. And we'll have you down when it opens.
For sure, for sure.
Take care. Thank you.
Thank you so much.